Good morning. My name is Dr. Fabio Del Piero. I'm faculty at University of Pennsylvania, New Bolton Center. Today I'm going to present you diseases of horses. These slides have been gathered in more than 10 years of diagnostic and research activity in several Europeans and several parts of the United States, especially in England, Cornell University, and University of Pennsylvania. All this material belong to my collection, except a few slides. And for these few slides, I would like to thank Professor De La Janta of Cornell University, Professor John King of Cornell University, and Dr. Habecker of University of Pennsylvania. We can start with the first slides now. We start considering the lesions of the erythron and of the leucon. This is a classic normal spleen from a fall. The falls are characterized by, the equine spleen is generally characterized by abundant lymphoid follicles, very prominent. Anytime there is a dramatic decrease in volumes of lymphoid follicles, combined immunodeficiency, severe combined immunodeficiency has to be suspected. This is a condition with dramatic reduction of B and T cells, which predispose to secondary severe infection that leads the fall to death. In this case, a severe case of necrotizing bronchiolitis with prominent inclusion bodies, eosinophilic and basophilic, pathognomonic of adenovirus type 1 and type 2 virus infection. Regarding lesions of lymph nodes, this is a case of severe suppurative cervical perilaryngeal lymphadenitis, strangles, which are very common in young animals. In cross-section it's possible to see prominent exudate. The same condition can affect other lymph nodes, not necessarily the cervical tract, but also in other locations, like in this case, the mesenteric lymph nodes with abundant exudate. Lymph nodes can also be characterized by other types of exudate produced by different etiologic agents. In this case, a severe case of mesenteric caseous lymphadenitis with this abundant exudate, which is different, is yellowish, has got a caseous appearance, and is caused by Rhodococcus equi infection. Typical location of caseous lymphadenitis due to Rhodococcus equi infection are mesenteric lymph nodes, but also, of course, lung lymph nodes. Splenomegaly. Splenomegaly can be caused by various conditions, inflammatory and neoplastic, and the enlargement is diffuse in inflammatory condition, can be diffuse or focal or multifocal in neoplastic condition. A very common cause of splenomegaly in the horse is lymphoma lymphosarcoma, like in this case, with a multifocal distribution. But also, barbiturate injections can cause commonly splenomegaly. Barbiturate injection used to induce euthanasia. When the splenomegaly is moderate to severe, and when there is also involvement of the lymph node of the spleen, equine infectious anemia caused by equine retrovirus has to be suspected. icterus associated with hemolytic anemia can be easily detected in the adult, in the fall, or as in this case, in the fetus, checking the ocular mucosa. When icterus is seen, like in this case, in the newborn, neonatal isoerythrolysis has to be suspected, and also equine herpes virus 1 infection, hepatic necrosis, has to be considered. The bone marrow in the equine species, like the other species, needs always to be checked at necropsy, grossly, cytologically, and histopathologically, and grossly is possible to detect atrophy or hyperplasia. In this case, a severe hyperplasia of the bone marrow due to a progressive anemia associated with a neoplastic condition inducing mild to moderate intrapulmonary bleeding. In the first phases of equine infectious anemia, the same condition could be observed. In case of neoplastic diseases, for example, lymphoma or metastatic condition, large areas of the bone marrow can be replaced with neoplastic tissue. Digestive tract. The tongue can be affected by several injuries. A common condition in the newborn fall, rarely in the adult, is a progressive, diffuse, parakeratotic hyperkeratosis of the lingual epithelium. This is associated to an opportunistic infection of yeast, especially Candida species, which can take advantage of immunosuppressed individuals, often emaciated individuals. The gross appearance is formation of a diffuse plaque or multiple whitish plaques on the dorsal surface of the tongue. The esophagus can be affected by focally extensive distal hypertrophy of the esophagus, is hypertrophy and hyperplasia. The etiology of this condition is unknown, and it can affect mildly, moderately numerous sources, and generally induce clinical signs, detectable clinical signs, in a small percentage of patients. Occasionally, but this is a very rare event, the condition can be diffuse, can involve the whole organ. Occasionally, the same changes can at the same time involve the distal ileum with prominent enteric clinical signs. Ulcers in the equine stomach are common. They can be associated with stress, with starvation. 18 hours of food can induce the formation of small ulcers. Also can be induced by parasitic condition, generally focal, multifocal, associated with the infestation of Gasterophilus species. In this case, the ulcers are located on the margo plicatus, are chronic, active, deep, involving the squamous portion, but also, in this case, involving the secreting gastric portion. And this is a case of severe gastric ulceration due to administration of non-steroidal anti-inflammatory drugs. Sometimes in the falls, the lesions are very severe, not involving only the margo plicatus, the secreting portions, and also the rest of the squamous portion, but also affecting severely the proximal duodenum with severe ulceration, and sometimes perforation occur. Again, this is a case of severe gastric and duodenal ulceration in a fall due to non-steroidal anti-inflammatory drugs. If there is no perforation, the fall survives and the ulcer heals, it's possible to observe the formation of a scar with retraction of the connective tissue, stenosis formations. In these cases, often it's possible to observe, because of the stenosis, an ascending cholangitis with prominent dilatation of the bile ducts, and also an ascending pancreatitis. At the same time, gastric reflux occurs with formation of gastric ulcers and esophageal ulcers. This is a severe case of ascending linear multifocal reflux esophagitis with deep erosion ulceration and fibrin deposition in a fall. And this is a fall where the gastric reflux was prominent. In this case, the major lesions were again on the margo plicatus, extending on the gastric squamous portion, and it's possible to observe here a dark area where there was even a perforation with then secondary septic peritonitis, a fatal condition. Non-steroidal anti-inflammatory drugs can induce also severe lesion in the right dorsal colon. In this case, a severe hemorrhagic necrosis with superficial erosion ulceration. Non-steroidal anti-inflammatory drugs are able to inhibit prostaglandin action on blood vessels with favoring ischemic phenomena with then progressive necrosis of the tissues affected. Squamous cell carcinoma is one of the most common neoplasm of the horse and can affect the stomach. It's the most common primary neoplasm of the equine stomach and is characterized by a rather prominent sclerose growth characterized by abundant epithelial neoplastic tissue, but also by a prominent stroma. The diffusion of the tumor eventually involves also other visceral organs with a multifocal neoplastic distribution called carcinomatosis, which is characterized by multiple whitish neoplastic masses on the serosal surfaces. The rupture of the stomach in the equine species is a frequent cause of sudden death. The progression of the rupture is typical, is predisposed or by a distal obstruction which is grossly evident at the necropsy inspection, but occasionally this predisposing factor is only clinically evident, often is a paralytic ileus. So for the pathologist, it's important to know the clinical history to identify the primary cause of this gastric rupture. And the first gastric layer to rupture is the tunica muscularis, followed by the serosa, and then eventually the mucosa. Sometimes the rupture is rather wide, but often the the only solutional continuity of the mucosa is small. And the secondary result is septic peritonitis, characterized by fibrin on the serosal surfaces and some digesta. If there is an autolysis process with bacteria within the peritoneal cavity, it's also possible to not be able to detect the fibrin. And in this case, the rupture should be differentiated between in vivo rupture and a rupture due to postmortem gastric dilatation. Checking the edges of the wound of the rupture for irregularities and blood and fibrin is always a useful way to detect intravitan rupture with a postmortem rupture. Gastrophilus species, in this case Gasterophilus intestinalis, are able to colonize the macroplicatus, the equine stomach, inducing multiple ulcers, but at the same time often circumferential hyperkeratosis of the squamous portion of the stomach. The proximal intestine can be affected by acute sudden bacterial colonization, especially Escherichia coli and Clostridium species, with segmental severe necrosis. This condition is called cranial enteritis, anterior enteritis, or by pathologists segmental proximal duodenitis, and is a condition that we keep seeing clinically and, of course, on the necropsy floor. Clostridiosis is a condition that can be seen in adult horses, but even more severely and sometimes more frequently in young animals, in foals. The bacteria, Clostridium species, especially Clostridium perfringens type C and type D, are able to produce very powerful necrotizing toxins, inducing an acute coagulative necrosis of the intestinal mucosa. In this case, there is severe necrohemorrhagic, gangrenous enteritis, but also typhlitis and then multifocal segmental colitis. In this case, the lesions need to be differentiated from intestinal displacement, but when the lesion is multifocal with such a distribution, is caused by Clostridia. And then further identification can be performed with histopathology and bacterial cultures and biochemical molecular identification of the toxin type. Cecal dilatation can be a cause of chronic colic and sometimes sudden death in the equine species. The primary factors, primary etiologies are unknown. Occasionally it's possible to see ganglionitis histologically, but often the cases are just characterized by edema of the cecal wall and thickening of the tunica muscularis. Grass sickness can induce severe impactions. The impaction is progressive, starting cranially and being very severe caudally. Generally in the cecum, there is accumulation of this foamy, sticky digesta. The pathogenesis of the disease, also called equine dysautonomia, is the following. Possibly a toxin, maybe a clostridial toxin, maybe a toxin of other origin, is able to induce necrosis of the ganglia of the small and large intestine with progressive dysmotility and impaction. The overall can be affected by a condition very similar to the human Hirschsprung disease. The similarity are such that this is an animal model for the studies of colonic hypogangrionosis or aganglionosis in the human species. In these falls, there is a defect in the migrations of the neural cells to the small intestine, especially to the large intestine, with a progressive decrease of motility or absence of motility in the distal tract of the equine intestine. The same defect is also applied to the melanocytes. For this reason, the pigmentation of these folds is such, is whitish. These animals survive for a short time, and a severe impaction on meconium can be observed. Often secondary bacterial infections, especially E. coli and Clostridiosis, occur due to this intestinal stasis and secondary bacterial proliferations. Impactions, in this case, cecal impaction, can be associated with secondary ruptures. In this case, in this cecum, it's possible to see severe edema, congestion, hemorrhage, and a rupture here in this area between the base, the cecum, and the body of the cecum. Ruptures are not necessarily only associated with impactions, but also associated with parturitions, especially after pregnancy, after parturition. These visceral ruptures and other displacement can be associated in the mare. This is a case of multifocal necrosis of the large colon associated with a diffuse edema of the organ. And this condition is characteristic of thrombosis caused by fibrin emboli, inducing occlusion of intestinal blood vessels, and these emboli are produced at the level of the cranial mesenteric artery. This is a condition we see much less now, and because of the diffuse use of effective anti-helminthic drugs, because this condition is caused by the localization at the level of the cranial mesenteric artery of Strongylus vulgaris L4 larvae, which induce a progressive chronic fibrinous endarteritis with thrombi formation, which then can shed downstream toward the large intestine, again inducing the formations of these large areas of necrosis. It's frequent to see on the serosa of the small intestine, especially the ileum, this serpiginous fibrous proliferation characterized by this reddish color. This is a case of hemomelasma ileae. On the textbook, it is reported that hemomelasma ileae is due to parasitic migration. This is possibly true for some cases, perhaps the one that are characterized by a serpiginous appearance, although it's very difficult, it's very rare to be able to detect some strongyl larvae within the lesion, but also we observe frequently lesion with the same pattern even more distally and more caudally, not associated with parasitic infections, but associated with intestinal displacement or history of colic. We speculate that this condition could be also caused by stretching of the serosa with formations of hematomas and then progressive fibrosis. Among the intestinal displacement, torsion and volvulus are common conditions. These are cases of volvulus. A twist characterized by a segmental severe congestion, hemorrhage, and ischemic necrosis of the affected tract. These are very common condition in the equine species and is reason of many surgeries. And then displacement can be also involving other tracts of the intestine, especially the large colon. These are large colon volvulus. The majority of this displacement, the level of the large colon, are at the base of the organ. In this case, and it is an infrequent condition, at least for the pathologist, the involvement is in the mid portion of the organ. Again, there is association with diffuse congestion, hemorrhage, and necrosis. Volvulus can be also associated with strangulation, generally due to a peduncle lipoma, or just strangulation caused almost always by a peduncle lipoma. Lipomas are common in horses and ponies, and they can act like a bolus, an Argentine bolus, wrapping around with their stalk a portion of small intestine, inducing the same ischemic, segmental, hemorrhagic change seen for the volvulus. Often, portion of the lipoma can be necrotic, can attach to a serosal surface, and the stalk can form a hernia ring where a portion of small intestine can penetrate and get strangulated. Sometimes it's difficult to differentiate between a segmental hemorrhagic necrosis of the small intestine caused by a clostridiosis, or, like in this case, a segmental hemorrhagic necrosis caused by strangulation. In this horse, the diagnosis was easy because this segment of intestine was identified within this hernia ring that was traumatically produced on the diaphragm of this horse. So diaphragmatic hernia with intestinal strangulation and ischemic hemorrhagic necrosis. This is another common cause of displacement in the equine species. This is a portion of ileum penetrating within the cecum. So this is a case of ileocecal intussusception with secondary edema, congestion, and necrosis of the portion of the ileum that was herniated, penetrated within the cecum. The ileum can be relatively frequently affected by hypertrophy and hyperplasia, like observed and discussed for the distal esophagus. And here the thickening is rather severe. And frequently, in this condition, it's possible to observe a weakening of the wall because there is proliferation of smooth muscle cell, but there is not enough stroma, fibrostroma, to support that portion of proliferated smooth muscle. So there is a weakening in the wall and formation of diverticula. Occasionally there can be rupture of the diverticula with formation abscesses or even acute septic fatal peritonitis. Inflammatory conditions due to bacterial agents, especially in the large intestine, are common in the equine species. They can affect foals, but even more frequently adults. They can be primary or they can be secondary to the administration of antimicrobial therapies, which select the bacterial flora towards some highly pathogenic bacterial, which could be some strain of Escherichia coli, could be Salmonella species, but frequently are Clostridium perfringens and Clostridium difficile. And this is a classic presentation that can be shared by several species of bacteria. It's a case of fibrinous, erosive, ulcerative colitis. Occasionally the odor of the exudate can indicate towards Salmonella. The Salmonella infection can be characterized by a very prominent odor, which can be defined as sometimes like a septic tank odor. And this is a case of chronic salmonellosis. The previous was an acute case of salmonellosis. In the chronic cases, the lesion is progressive. It induces a progressive accumulation of exudate on the surface with severe modification processes of the mucosa, which becomes very thick and always characterized with this rather malodorous exudate. Sometimes the presentation the following. Again, this can be caused by Clostridium species, can be caused by Salmonella, and occasionally certain strain of E. coli, where the lesions are severely hemorrhagic and necrotic, and the major difference is with displacement. For instance, large colon volvulus and other conditions like that is that generally there is a diffuse involvement of the whole intestine. This is a portion of the large colon affected by severe diffuse edema. Severe diffuse edema in the large colon can be associated with displacement that's been surgically resolved and then the patient didn't survive, was euthanized, or can be associated with infections and primarily with can be observed in the condition called Potomac horse fever, which is caused by the bacterium Ehrlichia eristicei. Also, the condition is called monocytic ehrlichiosis, which is characterized by severe edema of the mucosa and the submucosa, and then histologically by a monocytic infiltrate, where immunohistochemically or with silver stain or PCR, the presence of rickettsia can be identified. The same condition can be associated with abortion. In this case, there is a severe thickening of the small intestine and also the lymph node. Grossly, the differential diagnosis between idiopathic granulomatous enteritis and lymphadenitis due to unknown cause, a condition morphologically rather similar to paratuberculosis in cattle, but Mycobacterium avium paratuberculosis or similar bacteria have not been identified in this condition in the horse. And the differential diagnosis, of course, in this case is lymphoma, alimentary lymphoma of the intestine, with primary infiltration of the intestinal mucosa and then progressive involvement of the mesenteric lymph nodes. Regarding the parasitic infestation of the intestine, in foals, although with the treatment with proper anti-helminthic drugs, their number decreased dramatically in the last years, it's still possible to observe in certain cases infestation with Parascaris equorum, large ascarids, which, if present in large numbers, can induce impaction and even rupture of the small intestine. In the large intestines, in horses which have not been treated with the proper anti-helminthic drugs, it's possible to observe large strongyle infestations, Strongylus vulgaris, Strongylus equinus, and Strongylus edentatus. In this case, there is a dual infestation, not only adults of large strongyles, but also small black dots corresponding to encysted small strongyle larvae. These horses can be anemic. When small strongyle larvae, the cystostome larvae, are encysted within the mucosa, are not receptive to anti-helminthic drug treatment, but at the same time are also not pathogenic. But when they are able to colonize severely the large intestine of the equine, they are able also then to merge in large numbers and to induce severe colitis with often a severe bacterial colonization that can be also fatal. This condition is not very common in the United States, but is observed frequently in some European areas characterized by less anti-helminthic drug treatment and rather wetlands where basically survival of parasites in the external environment is enhanced. Particular anti-helminthic drugs have to be used to control tapeworms in any species, and particularly in the horse. So a prominent treatment against nematodes cannot control tapeworms. Other molecules are needed. And in this case, tapeworms can induce severe infestations at the level of the ileocecal orifice with a focal, moderate to severe, fibrinous, even ulcerative typhlitis, and even with some prominent hyperplastic modifications of the ileocecal orifice. This infestation can be also occasionally induced with colics. Some colics speculate that they may be able to predispose to intussusception or artery displacement. The data is being analyzed, and they're not always statistically significant, but definitely the tapers can induce a severe focal irritation and can be present in large numbers. This is a case of anoplocephala perfoliata infestations. The other two types are anoplocephala magna and Parnoplocephala mammillana. Sporadically, still possible to see Oxirises infestation in the small colons. This is a case of Oxirises, pinworms, rarely associated, in our case, with clinical signs and often an incidental finding. Neoplastic changes of the intestines. Lymphoma, as we discussed, is a common condition affecting the small and large intestine of the horse. Another sporadic primary tumor of the equine intestine are gastrointestinal stromal tumors, which are comprised by cells with neural differentiation or cells with myodifferentiation or sometimes with undifferentiated cells. They can be focal or multifocal. In this case, there is this gelatinous, multilobulated, cigar-shaped growth on the surface of the cecum, and this is one presentation. Then they can be multifocal, involving the small intestine and also involving the nerve distributing on the mesentery. In this case, they can be also inducing alteration of the motility with thickening of the muscularis mucosae and the whole intestinal wall. And occasionally, they can behave like pedunculated lipomas. They may be multiple. In this case, there is a 3-lobe one, which induce a compression and a strangulation on this portion of ileum. Regarding the liver, a very common incidental finding is the atrophy of the right liver lobe, often associated with compensatory hyperplasia or the rest of the organ. Although the real pathogenesis are not being studied in deep, it's speculated that compression of viscera on this portion of the liver could induce a progressive atrophy, then followed by the compensatory hyperplasia. So ischemia associated with progressive compression of the large colon, the cecum, on this portion of the liver. This is a cross-section of a liver affected with multifocal to diffuse fibrosis. In this case, the fibrosis is diffuse, and it gives this nutmeg-like pattern to the organ. And this progressive fibrous proliferation is associated to edema caused by systemic passive congestion due to heart disease or pulmonary conditions. This is a case of serum hepatitis, also called Taylor disease, and this is a case of severe hepatic necrosis, which induced this flabby appearance to the organ that appears like that. It's also called, this condition induces this pattern of the liver, which is called discharged liver. The differential diagnosis is autolysis. Livers that are severely autolyzed can have the same appearance. Unfortunately, in some cases of serum hepatitis, there can be also autolysis, so the process can be emphasized, and sometimes the autolysis is such that it can be histologically even difficult to recognize the disease. Serum hepatitis is associated generally to administration of a biological product 20 days or 40 days or more before in the patient when then this condition occur. And some colleagues speculate that this still could be considered perhaps a viral infection. Other people believe that is a idiosyncratic reaction and some biological components contained in the vaccine or in the antiserum, which is often associated with this condition. It is a cross-section of a liver affected by serum hepatitis, and the necrosis is involving any lobules and can be seen in this multifocal to coalescing pale discoloration. Livers of horses, but especially ponies, miniature horses, donkeys, can be affected by severe lipidosis, especially in horses that because of stress, shipping, parturition, have a negative energy imbalance. And the liver affected by the severe lipidosis become friable, and in this case rupture associated with severe hemorrhage can occur with progressive bleeding and sometimes with sudden death associated with exsanguination. The differential diagnosis grossly in this case is amyloidosis. The differentiation is difficult to obtain just observing at the picture because they look the same. But during the organ manipulation, especially during the dissection of the organ, this difference is very clear because in case of amyloidosis, there is no deposition of fat on the knife blade, and with the in case of hepatic lipidosis, when the prosector cut the liver, you will be immediately see this greasy appearance on the organ surface and also on the surface of the knife. The liver, like of the equine species, like the liver of other animal species, can be affected by toxic hepatopathies, and it is a case of post-necrotic nodular regenerations. Toxic substances like alkaloids on some plants can induce severe necrotizing lesion at the level of the liver, and then if the animal survive, there can be a progressive nodular regenerations involving the whole organ, and this presentation is not infrequent. Parasites of the liver. Before the introduction on the market of very effective anti-helminthic drugs, multifocal granulomatous hepatitis with mineralizations, like seen in this case, were very common in horses. Now this condition is, which is often an incidental finding, is much less seen. And migration of Strongylus larvae are able to induce whitish tracts in the liver due to the fibrosis, a result of the process of the healing on the larvae tract. But at the same time, some larvae die, and then there is a granuloma formation with deposition of calcium. In the past, this lesion had to be differentiated with other granulomas, especially the granulomas associated with glanders, a bacterium which is also a dangerous zoonotic agent, which is not present now in Western Europe and United States, but during the First World War was able to induce severe lymphadenitis and severe granulomatous and necrotizing conditions in both horses and humans. This liver is affected by a prominent discoloration, a dark discoloration. This is a liver animal that was emaciated, and this liver is smaller than normal and with this dark color due to absence of glycogen and lipids within the hepatocytes, but also the liver is affected by multiple hydatid cysts. This is a case of Echinococcus Granulosus infestation. And the horse, like other herbivores, is an intermediate host of this parasite. And this is a cross-section of an hydatid cyst, which even is possible to observe the formation of some daughter hydatid cyst. And this is where the hydatid sands containing the scolyses is contained. Lymphosarcoma can affect the liver with a multifocal distribution or a diffuse distribution of the liver parenchyma, which can induce obstruction with this greenish discoloration, which is associated with, which is basically caused by cholestasis, and then often prominent infiltration of the hepatic lymph node with lymphadenomegaly. Other neoplasms of the livers can be carcinomas, sarcomas. This is a case of sarcoma. The diagnosis will be histological, cytological, and certainly immunohistochemical. In falls, it's possible sporadically to observe a tumor which is malignant, affecting the liver, and even can metastasize to other organs with this pattern, and this neoplasm is called hepatoblastoma. The peritoneum can be affected by infectious and neoplastic processes, and perforations and ruptures of the internal organs, of the viscera, can be associated with fibrinous septic peritonitis, like in this case, with prominent deposition of fibrin. And this is the second part of diseases of horses. Respiratory diseases. Infections of the nasal cavity of the sinuses are common in the equine species. They can be viral, bacterial, fungal. And this is a case of fibrinous sinusitis characterized by this proliferative mass with this whitish material on the top. And this is a mycotic growth, Aspergillus species. Chronic inflammation in the nasal cavities and also in the sinuses can be associated to the growth of masses, gelatinous, variously sized, and these masses are called inflammatory polyps. They need to be differentiated to neoplastic lesions. These are inflammatory lesions produced by a chronic stimulus, generally bacterial causes. This is a relatively common entity in the equine species, the so-called ethmoidal hematoma. The cause is unknown. Is a progressive growth of granulation tissue, sometimes even associated with some prominent histiocytic proliferations and deposition of abundant hematic pigment, generally hemosiderin, but also other pigment that are result of degradation of the iron contained in the red cells. And this is caused by progressive chronic mild bleeding. Proliferations of masses in the nasal cavity of the horse can be observed. They can be inflammatory in origin, as we recently discussed, but they can be also neoplastic. In this case, a proliferation of this neoform mass, in this case a squamous cell carcinoma, but in this case, just with a gross evaluation, with no histological examination or cytological examination, the differential diagnosis could be granulomatous proliferation, squamous cell carcinoma, adenocarcinoma, carcinoid, and even in some cases lymphoma. Mycotic infection of the guttural pouches is still a common entity in the equine species. The etiologic agent are fungi of the genus Aspergillus. Generally, the medial part of the guttural pouch is affected, and there is a progressive mucosal erosion, ulceration, exudation of fibrin, and then progressive growth of the fungal hyphae within the underlying connective tissue, with invasion of small-sized blood vessels, thrombosis, necrosis, and eventually there may be some involvement of the internal carotid artery with mild or even severe bleeding within the guttural pouches. There is also involvement of the surrounding bony structures with some fungal osteomyelitis. Some colleagues believe that trauma could predispose the bone lesion associated with it. Sometimes the death of the horse is due to severe hemorrhage within the guttural pouch, and then deglutition, progressive deglutition of the blood within the stomach. So occasionally a finding could be large quantity of blood within the stomach, which gives, in addition to the digesta, a characteristic odor such as a apple cider odor. And then in other cases the hemorrhage is the hematic content of the guttural pouches is expelled through the nasal cavity with severe bleeding apparent on the nostril and then in the external environment. Ascending neuropathy of the left laryngeal nerve, especially in the large breeds, causes a progressive atrophy of the left cricoid muscle with laryngeal hemiplegia. Is a denervation atrophy characterized by decreasing size of the muscle and then progressive whitish discoloration. Regarding the lung lesions, pulmonary edema is a common finding in the horse, can be easily produced during the agony in certain episodes of euthanasia, in cases of sudden death, not necessarily related to a pulmonary cause, but also as a gross finding, it may characterize the lung in case of viral infection and shock like septic, anaphylactic shock, or endotoxic shock. Grossly, the viral conditions affecting the lung of the horse are difficult to be differentiated. It's necessary to perform histological examination and possibly immunohistochemical detection of viral agents. In this case, there is the lungs are wet, the interstitium is more prominent in this 1-year-old filly, and this is a case of pulmonary vasculotropic equine herpes virus 1 infection. The diagnosis is histological immunohistochemical, and it's impossible to differentiate grossly this condition from velogenic equine arteritis virus, a pure infection due to equine influenza virus, and other herpes virus infections of the horse, septic shock, anaphylactic shock, some cases of purpura hemorrhagica characterized by less hemorrhage and more edema. This is the previous lung in a cross section of this pulmonary vasculotropic equine herpes virus 1 infection, where the respiratory epithelium is not affected, but the virus is able to infect electively endothelial cells of the lung and induce vascular necrosis, and then intraalveolar edema and fibrinous exudation within the airways. And the fibrin here can be noted within the lumen of the bronchi. This is a case of equine artery virus infection in a foal. This is a newborn, and the lesions are severe pulmonary edema, gastric mucosal edema, and even hepatic edema. Histologically, in these cases, it's possible to identify bronchointerstitial pneumonia. If the animal survived more than 2 or 3 days, it's possible also to detect the vasculitis. But again, grossly, it's impossible to differentiate this viral pneumonia from the other condition that we mentioned. This is a slide that belongs to the Department of Infectious Disease of Plum Island. It is a close-up on the interlobular space of this horse, which has been experimentally infected with African horse sickness orbivirus, and there is a severe interstitial edema. Again, grossly, this condition cannot be differentiated from other viral diseases and other non-infectious conditions of the horse. This slide belongs to the Department of Pathology of University of Milan, and there is a severe diffuse acute hemorrhage involving both lungs, and this is a case of severe purpura hemorrhagica in a foal caused by Streptococcus equi antigen antibody complexes vasculitis. Thoracic empyema is a very common pathological entity in the horse, a fatal entity, and in this case there is a large quantity of fibrin covering the pleural surfaces, abundant exudate. And this is predisposed by bacterial infections involving primarily the lung, the cranioventral part of the lungs, Streptococcus equi, Streptococcus equi zooepidemicus are the major etiologic agents. And unresolved pneumonic processes can result in the formation of septic areas of necrosis, like in this case, characterized by a central area called sequestrum and generally tiny, mild proliferation of connective tissue at the edges called involucrum. And there may be a progressive bacterial proliferation inducing even a rupture of the thin wall with pouring of septic exudate within the thoracic cavity, with the formation of pleuritis and a prominent empyema, as we saw in the previous picture, or even a progressive passage of septic material and bacteria within the lymphatic, and then a progressive passage of bacteria within the thoracic cavity anyway, with the formation of the same lesion. And again, the final results is the following. Rhodococcus equi is able to induce caseous lesions. We already discussed the caseous lymphadenitis caused by Rhodococcus equi in the horse and occasionally also in other species. And this is a case of caseous multifocal to coalescing pneumonia caused by Rhodococcus equi. There is a central prominent abscess characterized by this caseous cheese-like material, and then also a multifocal granulomatous pneumonia. Rarely, this bacterium, which is very similar to Mycobacteria, can be associated also to Pneumocystis carinii infection, but it's not very common. Mycotic pneumonias can be seen in several species, including the horse. Generally, there are multifocal lesions, sometimes target-shaped. In this case, there is a prominent area affected with multiple foci of necrosis, and histologically it was possible to detect multiple Aspergillus species hyphae penetrating within the blood vessels and inducing thrombosis. In the horse, this pulmonary mycotic condition is predisposed by enteric salmonellosis, which is characterized by severe leukopenia and probably a sudden decrease of immunitary defenses with a secondary mycotic opportunistic proliferation within the lung. Mucoid bronchiolitis is, can be a cause of chronic obstructive pulmonary disease in the horse. It's generally triggered by various antigens, allergens, especially fungal antigens, and generally there is a progressive infiltration of inflammatory cells, especially lymphocytes, some plasma cells, some neutrophils, and generally some eosinophils around the bronchioli, and also hypertrophy and hyperplasia of the goblet cells, then with diapedesis of inflammatory cells within the lumen and formation of, with the mucus of these mucocellular plugs, which then induce the chronic obstructive pulmonary disease, sometimes associated with alveolar emphysema. caudal, unilateral, or even bilateral hemorrhages in the lung can be observed in several horses suffering of exercise-induced pulmonary hemorrhages. The majority of the horses that race have these problems, and several of them are not clinically evident, but they're definitely evident at the postmortem examination if this episode of acute caudal hemorrhage are severe enough, and they can be bilateral or unilateral. Acute, like in this case, this is a biopsy site. This horse had a pulmonary biopsy before the euthanasia. And when these lesions are chronic, for repeated episodes of hemorrhage, they can have this whitish fibrotic aspect, generally slightly greenish because of the hemosiderin deposition in macrophages. And they are associated to increased cardiac output and then increase of pulmonary pressure, and then capillary erythrocytes diapedesis, and eventually also rhexis of capillaries with more severe hemorrhages. This condition is not present in all the countries where horses are bred, but generally in areas characterized by wetlands with not a lot of use of anti-helminthic drugs. There are two lesions in this case. One is a alveolar emphysema, which is characterizing both lungs of this rather old horse, and the other lesion is this multifocal hemorrhagic pneumonia, histologically characterized by abundant infiltration of eosinophils, and this is a multifocal verminous pneumonia caused by Dictyochirus anfieldi, which is the lungworm of the horse. The horse is a parathenic host, so it is not a classic biologically adapted definitive host of this strongyle, so the larvae generally induce much more damage in the horse than the damage they induce in the real definitive host, which is the donkey. So the presence generally of donkeys in the field predispose this kind of condition in the horse. Primary tumors of the equine lung are rare. This is a condition that is seen at least generally just once every 2 or 3 years in a very busy diagnostic and research unit like our at New Bolton Center. And this tumor is the granular cell tumor of the equine lung. For a long time, it has been believed to be of myeloid cell origin, and immunohistochemically and with electron microscopy, it's possible now to say that these cells are cells of neural origin because they express neural markers, and also morphologically with ultrastructure it's possible to see that they look like Schwann cells. And then metastatic tumors can be observed in the horse. Grossly is possible just to speculate about their origin. Lymphomas generally tend to be soft and whitish. In this case, the tumor was slightly yellowish, firm. So the differential diagnosis was between carcinoma and sarcoma, and then histologically immunohistochemically it was possible to identify this tumor as a undifferentiated sarcoma, originating from an area very close to the adrenal glands. Regarding the heart, the rupture of the base of the aorta is rather common in the horse. Occasionally can also affect newborn foals, rather rarely, but it can. There are two areas where this lesion can occur. One is the following here, above the semilunar aortic valves, and then the other side is just below the valves. There are several theories about the pathogenesis of this condition, and definitely trauma has to be associated with this condition that can be observed in horses that fall on the ground during racing, mating, or even during euthanasia. And the result is generally hemorrhage that dissect through the connective tissue around the heart, or a severe hemopericardium. Vegetative bacterial endocarditis, valvular endocarditis, can be observed in the horse like in other species, less frequently than in cattle, occasionally in foals, predisposed by a septic focus in some anatomical areas like a foot abscess, a skin wound, and then predisposed by some changes in the endothelium of the valves, sometimes predisposed by a congenital valvular anomaly or a change in the blood flow, always predisposed by some even mild dysplastic change of the areas where the bacteria can adhere and then stimulate an inflammatory process with deposition of fibrin and additional bacterial growth. Clearly, any septic focus localized on any valve can induce the formation of abscesses in multiple organs, especially lung and kidney. Cardiotoxins with myocardial degeneration, necrosis, and then large areas of attempts to repair with fibrosis granulation tissue formations can be observed in the horse. This is a case of ionophoric antibiotic toxicity. This horse was able to eat some chicken feed that's been medicated with lasalocid, and the result was a severe cardiomyopathy, necrotizing lesion in the heart and also in the skeletal muscle. There was severe lesion in the gluteal muscle and in other skeletal muscle areas. And here is possible to see a subacute lesion tending to chronicity with fibroplasia, fibrous proliferation, and also some granulation tissue formation here. This lesion is more common in cattle, but occasionally in foals with survive some episode of septicemia. It's possible to see severe septic fibrinous pericarditis characterized by abundant deposition of fibrin around the heart in the pericardial cavity. This was associated with Streptococcus equi zooepidemicus infection in a foal that survived an episode of septicemia and had also polyarthritis. Jugular vein thrombosis in the horse, generally unilateral, is common and is generally a septic thrombosis and can be caused iatrogenically by an injection or catheter positionment in a horse with or bacteremia or septicemia. and embolic lesions in the lung are frequent. So often, in association with this severe thrombosis and remodeling of the jugular vein, it's possible to observe an embolic necrotizing pneumonia, deriving just by septic emboli shedding from this area. Congenital abnormalities in the equine heart are probably less common than in other species, but can be relatively frequently observed. Perhaps some breeds, especially perhaps miniature horses, can be predisposed, although data are probably still a little bit insufficient to say something definitive. And this is the heart of a miniature horse with a prominent interventricular septal defect. There are also other congenital conditions that can be observed. One is the tetralogy of Fallot, and multiple vascular abnormalities, sometimes associated also with hypogenesis and dysplasia of the respiratory tract. A cause of sudden death in the horse or cardiac dysfunction in the long run is rupture of a chorda tendinea, like in this case, at this valvular level, at this atrioventricular valve. It's possible here to see that stretching this part is not possible to join them. This is a chronic case because this edge is blunted, also this one. So these animals survive quite a bit. If I remember well, 1 month before having systemic passive congestion characterized by hepatic edema and also a severe pulmonary edema. Also, in this case, the valvular leaflets are thicker with some acquired fibrotic changes. Regarding blood vessel lesion that can be appreciated grossly, definitive diagnosis of verminous arteritis can be applied in this case. And this is a textbook lesion with the presence of fibrin, characterized the verminous fibrinous endoarteritis with intralesional L4 Strongylus vulgaris larvae. But at the same time, there is prominent thickening of the vessel wall and a dilatation here, also with some mineralization, which was evident at the palpation because of the formation of aneurysmic dilatation. As we discussed previously, in the first part of this presentation, this larvae or fragment of larvae with the fibrin can follow the blood flow and then induce thrombosis of the intestinal arteries with multiple infarct at the level of the large intestine especially, with severe colic and clinical signs. Skeletal muscle. When it's possible to observe a pale discoloration, like in this case, it's possible to say grossly that there is an atrophy of the skeletal muscle. Also, when there is also a reduction in size generally of the muscle. In this case, in the coccygeal area, close the sacral bone, and this is a case of denervation atrophy associated with a neuropathy of the cauda equina. The same pattern, the same gross pattern of lesion can be associated to the old denervation neuropathies that can be seen affecting the skeletal muscle. One of them, equine motor neuron disease, which often present with the same pattern at the level of the coccygeal muscles in the horse and also of the quadriceps femori and also at the level of the triceps brachii. When there is a whitish discoloration with no appreciable decrease in size, is a degenerative disease associated with a vitamin E and selenium imbalance, so-called vitamin E and selenium responsive myopathy, also called in Europe enzootic myopathy, and it's characterized by this whitish, in the severe cases, by whitish coloration skeletal muscle and even heart muscle and sometimes laryngeal muscle. So all the possible striated muscle which require good levels of vitamin E and selenium to have a thorough membrane, cellular membrane protection. Sometimes there is even a chalky appearance due to early mineralization of the muscle, which can be appreciated also grossly in some cases. Exertional myopathy, in the majority of the cases, can be appreciated only clinically with an increase of the skeletal muscle enzymes, but in this case led this horse to be euthanized because large part of the muscle of these animals are affected by acute necrosis. In this case, it's possible to see, especially in the ventral area, this kind of dry, pale aspect, which is correspond to a severe necrosis of this caudal skeletal muscle. Like in black leg cases in cattle, the gangrenous myositis induced by Clostridial proliferations can be seen in horses. The lesions are very similar to the cattle lesions. There is the formation of these lumps, and on the cut surface possible to see plenty of exudate and a foul odor. And then histologically it's possible to observe a severe hemorrhagic necrosis with vascular necrosis and presence of bacilli. And then Clostridium species can be identified and isolated. In the horse, occasionally associated with injection of some oily substances like vitamins or even some drugs. Lesion of the bones or the tendons and ligaments can be multiple in the equine species. I just here put a few examples. This is a severe injury to the suspensory ligament. Here there is a longitudinal section of the ligament. Here there is a cross section. This is a traumatic injury with severe acute hemorrhage and dissection of the fibers of the ligament. In falls, traumatic injuries can be frequent, associated with their behavior, and especially in colts. In this case, this colt was able to find a wire which is wrapped around his own leg and then induce not only an incision in the bone and a complete skin wound, but also a complete resection of the tendons. Joint infections are common in falls, especially after septicemic episodes. It's possible in this case to isolate Streptococcus equi, Streptococcus equi zooepidemicus, Actinobacillus ecoli, E. coli, and also Rhodococcus equi. The same agents can induce pneumonia, septicemia, polyarthritis, and formation of fistulous tract. This is a case of septic arthritis associated then with formation of fistula, which was opening here on the skin above the coronary band in this fall. The same bacteria, especially Rhodococcus equi, can be associated with osteomyelitis and discospondylitis and formation of vertebral abscesses, generally or above the heart or above the kidney in the vertebral column, but sometimes also in other locations. Degenerative joint disease is a common event in horses of all ages and all breeds. In this case, multiple linear indentation in the articular cartilage, which can be affecting one joint or multiple joints, sometimes even more severe than this condition. Formation of bony cyst-like structures, indentations, and they can be all associated with osteochondrosis, perhaps caused by early necrosis with ischemia in blood vessels of the below the cartilage, sometimes with formation of lesion reminding vaguely the infarcts in the soft tissues, and then with detachment of large or small areas of cartilage, like in this case, and sometimes with floating of these fragments within the articular cavity. These fragments that are called articular mice of various sizes. It's a condition that was seen much more in the past, and nutritional fibrous osteodystrophy affecting animals of any age, calcium phosphorus imbalance, especially in horses have been given particular feed stuff like bran. And the lesion can be unilateral or bilateral, associated with hyperparathyroidism, nutritional hyperparathyroidism, like in this Morgan filly, with a progressive remodeling of the bone in this area. And then in cross section, the formation of multiple cavities in embedded in this fibrous tissue. So there is progressive loss of mineralization and remodeling of the bone, and then formation of this cavity, which are associated with microfractures and formation of large hematomas. Surprisingly, the lesion can be even unilateral, not necessarily bilateral. But histologically, the other part of the other contralateral part was affected by the same changes. The reason why this lesion can be also unilateral, not necessarily diffuse, is unknown. Laminitis is still a rather common condition in horses, responsible of several prominent economic losses. This is a case of acute laminitis, and severe also, with a prominent detachment of the prominent necrosis and detachment of the keratogenic laminae, with detachment of the hoof wall. Several factors can predispose laminitis: infections, chronic and acute infection actually, trauma, certain kind of nutrition, and high fevers, increased production of endogenous corticosteroid due to neoplasm of the adrenal glands or neoplasm of the pituitary gland, inducing a positive feedback on the adrenal gland. Other causes are speculated. In the past was thought that the lesions primary an ischemic lesion, an ischemic lesion with formation microthrombi at the level of the keratogenic lamina. Now someone speculates that also metalloproteinases, so not necessarily only an ischemia, but even an hyperemia, which can be predisposing the resolution of this, the lesion at the level of this keratogenic lamina, and then the progressive detachment of them from the hoof wall. If the animal is able to survive the episode, it's possible to observe in the chronic cases a progressive prominent rotation of the third phalanx, sometimes even a perforation of the sole, and this is also due to the proliferation of the keratogenic tissue, which is an epithelial proliferation associated with a mild proliferation of connective tissue that push down the third phalanx. And of course, there could be also a secondary injury to the third phalanx with focal osteomyelitis, even formation of solar abscesses, and even embolic bacterial showers to other organs due to the infection. In race horses, it's possible to observe, due to trauma, of course, severe fractures of the cranial base, especially involving the basosphenoid bone, with prominent hemorrhages, sometimes even involving severely the base of the brain, and definitely then involving the sinuses and also the guttural pouches. Sometimes these traumas are also associated to partial complete ruptures of cervical muscles. And sometimes fracture can be multiples, not only involving the basosphenoid bones, but also involving the articular condyles, like in this case, and other part of the cranium. Hirsutism is a common condition seen in horses with large pituitary adenomas, like in this pony. And pituitary adenoma of the pars intermedia are common in the whole horse. At a certain point, almost any horse develops some pituitary changes. And these neoplasms can be associated with hyperadrenocorticism, hirsutism, and then any effect associated with high production of endogenous corticosteroids, like laminitis. They can be predisposed to infections. And also, the tumor itself can induce a compression of the hypothalamus with some dysfunction on the hypothalamic activity, and also a cranial compression of the optic nerves, even inducing partial or total blindness. Very common tumor in the horse. Another common tumor in the horse is the adenoma of the thyroid glands. Some of these adenomas are comprised of C cells, like is immunohistochemically detectable, and the majority of this tumor don't produce high level of hormones, although in the literature there are a couple of cases described which were associated with clinical signs produced by the secretion of thyroid hormones in these proliferations, in these neoplastic proliferations. They can be single or multiples, or even involving almost the whole thyroid glands. And of course, they can be bilateral or unilateral. Another relatively common tumor of the equine endocrine organs is the pheochromocytoma, in this case involving one adrenal gland. This is the tail of the adrenal gland, still unaffected, and this large mass, which is characterized by large necrotic cavities, can be affecting middle age and old horses. Sometimes with this tumor the patient dies because they rupture, so there can be intra-abdominal exsanguination. And these tumors produce hormones, and generally the contralateral adrenal glands is atrophied, and generally the atrophy applies to the medulla. And this is the neoplasm, a section neoplasm, the caudal part of the adrenal, which is partially unaffected, and then the contralateral adrenal, which is severely atrophied. Hemorrhages of the adrenal gland in the horse are frequent and can be observed in horses that die suddenly, in horses with septic shock, in horses with septicemia, and there are frequent features in foals that die of Actinobacillus E. coli septicemia. And histologically it's possible to see the hemorrhages, but also multiple bacterial colonies within the blood vessels. Although they can be associated with sudden death, they are not a pathognomonic lesion that indicates that the patient or the horse we are examined had a sudden death. This is the third part of disease of horses, and this is Dr. Fabio del Piero. This is an example of cerebellar abiotrophy in an Arab foal. It's possible to see that the volume of the cerebellum is severely decreased, and there are these two prominent sulci that are generally not evident due to the decreasing size of all these parts, especially the vermis. This condition observed also in other breeds, like Gotland foals, and is histologically characterized by a diffuse dramatic reduction in the thickness of the granular cell layers and also in the number of the Purkinje cells. Unusual localization of Streptococcus species infections, Streptococcus equi and Streptococcus equine zooepidemicus can be seen, like in this case, in the cerebrum, with formation of two abscesses. Ectopy localization of this infection is not frequent, but can be seen in several anatomical areas, including the brain and the spinal cord. Moldy corn poisoning is a sporadic entity that can be seen in horses which are eating feed contaminated with Fusarium moliniforme toxin, fumonisin B1, a very powerful mycotoxin, which is able to induce necrosis mainly of the white matter, so leukoencephalomalacia, but also with some extension in a few areas in the gray matter. Another example with necrotic areas, necrohemorrhagic areas, and here is the culprit. Corn infested with fungus, Fusarium moniliforme, which produce fumonisin B1. The same toxin in pigs induce a totally different effect, induce a severe pulmonary edema. The imported plants, Centaurea species, induce the so-called yellow star thistle poisoning with necrosis of the subcranial part of the brain, the nigropallidal areas. The lesion is severe, hemorrhagic, and bilateral. The toxic compound inducing this lesion is rapin, ST-lactone, which induce glutathione depletion, increase of reactive oxygen species, and cell membrane damage. In the past, it was possible to observe several cases of brain infarcts caused by Strongylosis vulgaris fragment emboli with formation of these triangular shaped lesions. Now, because of the prominent anti-helminthic treatment in our horses, this lesion became very rare. And the larval emboli originates at the base of the aorta, where the ostium of the carotid artery is, and so with opening, ulceration of these granulomatosis lesions, and then embolization. There is another helminthic condition that can induce encephalitis. Clearly, this is not a brain section, this is a renal section, but this condition is also prominent at the level of the kidney. And this is a case of Erysiphallobus deletrix granulosa nephritis, and the same changes, generally less proliferative, less prominent, can be seen also